Hello everyone, I am Dr-Keerthana Ravipati, fertility consultant at Milann Hospital at JP Nagar and HSR layout. Usually for a normal regularly menstruating woman in your menstrual cycle, once you start bleeding in your menstrual cycle, one of the follicle from either of the ovary will start to grow. This growth happens because of effect of some hormones in your body, mainly FSH, LH, estradiol, etc. As this follicle keeps on growing, it attains certain age, then the main hormone, which is the LH, will come into action, which makes this follicle and the egg inside to mature and further getting it released. So this released egg will be taken up by the fallopian tube on that side of the ovary, and it stays there, and the fertile window of this egg will be around 12 to 24 hours. So with the sexual intercourse, the sperm will reach the uterus followed by the fallopian tube, and there the fertilization of one of the sperm with the egg happens and embryo will be formed. This formed embryo will come back to the uterus and gets attached to the lining of the uterus, further proceeding as your pregnancy. This ovulation is the time where you have to do the intercourse to catch the maximum fertile period in your cycle. So I'll explain you how to track this fertile window. Typically in a regularly menstruating woman, egg release happens 14 days prior to your menstrual cycle. So if you are having regular cycles, track 2-3 cycles of yours and see whether you are having 28-day cycle, 30-day cycle. Based on that, you can decide when is your ovulation day. For example, if you are having a 28-day cycle, the ovulation will happen around 14th day of your cycle. Perhaps if you are having a 30-day cycle, 16th day will be your ovulation. So you can plan your intercourse activity around this period of ovulation. So usually the fertile window will last 4 days prior to the ovulation and continue on the day of ovulation and the day next to it. Among all these days, the most fertile window will be the day before the ovulation and the day of the ovulation. So you can track your cycle and find out these days and have sexual intercourse to increase your chances of conception. There is another method by which you can track your ovulation easily, that is urinary LH kit, which is available in the market freely. So this LH kit will identify your LH hormone increase, which I was telling you previously. You have to do your LH kit at least 4 days prior to the expected ovulation. So start doing every day once this urinary LH test and see whenever it comes positive. Usually ovulation happens within 24 hours from the positive LH kit. So you have to plan on the day of LH positive and the day next to it to get maximum chances of conception. So whatever we have discussed is for a regular cycle woman. If you are having irregular cycles, you can take the help of your fertility specialist to know your fertile days and plan your activity accordingly. Main thing we talk to all the patients is about the age. So it affects both in male and female. First we'll talk about the woman. The peak fertile period in a woman's age is mainly in their 20s. As they goes into 30s, so specifically more than 32 years and more specifically more than 37 years, there will be drastical decline in the fertility of the woman. Why is this happening? So one thing is quality of the oocyte and the quantity of oocyte both will get reduced as the woman ages more than 30 years. So mainly the number of the eggs available for the sperm to fertilize will be greatly reduced, and the second thing is the coping ability of each egg to various stress factors around it will reduce as the age increases. So this will lead into genetically abnormal egg or miscarriages or decline in the fertility. Next we'll talk about in men. In men, actually the drastical decrease in fertility is not as much as in female. So men keep on producing the sperm throughout their life. But the thing is the quality of the sperm that is getting affected with increasing age. So mainly the motility, the normal forms, that is the morphology and the count, may get decreased with increasing age in men also. So it's not like men are immune to age regarding the fertility. Both women and men should plan their family according to their age, keeping in their mind. If you are planning for delayed childbearing, you can visit your fertility specialist, get your fertility investigations done. Based on that, you can plan and keep your options open for fertility preservation also. As we have spoken, more than the age in men, many lifestyle changes are the reason for declined semen parameters in the men. These are very simple things which we can change in our life so that sperm health will improve. One of that primary thing is the diet and nutrition. Try having more of fruits, vegetables, and incorporate antioxidant rich diet in your daily routine. And another important thing is to incorporate omega-3 fatty acids in your diet. So the next thing when we go is tobacco and alcohol. Smoking greatly impacts the sperm health. That means the abnormal sperm rate will increase if you smoke regularly. Similarly, reduce your alcohol consumption, because this alcohol also, excessive alcohol intake also will reduce the sperm health. The next one is environmental toxins. Many toxins in the environment are also the causes for reducing the semen parameters. So, reduce the exposure to the pollution or other chemicals or endocrine disruptor kind of things, like which are seen in many fragranced cosmetics, etc. The next thing you have to take care about is physical activity. Try having at least 30 minutes of moderate activity in most of the days. Make it as a regular routine so that it will improve your sperm health. The last thing I want to discuss about is that you have to reduce your heat exposure over the groin areas so that normal temperature will be maintained around the area so that your sperm health will be better.